right, thank you very much for joining us today on the program, Healthy Living. I am Adesuwa Osawage. Today on the program, we want to look at something that is really disturbing the society at large. And this has to do with drug use, drug abuse, whether prescription drugs or drugs you get from the counter or drugs that have become illegal, drugs that are harmful, even those that were prescribed to you by the doctors that you are abusing or that you are not using right. That's what we want to look at today on the program, Dr. Healthy Living on Independent Television. And I have with me today on the program pharmacist Professor Henry Okeri. He is the chairman, Pharmaceutical Society of Nigeria, Edo State branch. You're welcome, sir.
Yeah, thank you, ma'am.
It's nice to have you join us.
Thank you so much.
All right. When we say drug abuse, Prof, what are we looking at? Which is when we just say drug abuse in general, exactly what are we talking about?
Okay. Two terms normally that people will confuse: drug abuse and then drug misuse.
Yes.
Now, drug misuse is taking a drug, incorrect use of a drug, or taking a drug for what is not intended.
Okay.
So that is misuse. Abuse is such that you don't need the drug. You just depend on it.
Yes.
You continue to take a drug for it's not prescribed. You don't need it, and you just want to be taking a drug for some other effects, euphoric effects, ecstasy, just like that. So that's an abuse. You don't need it.
Okay.
You can live without it, but you have now become a dependent.
Okay.
And so that is what is referred to the abuse.
All right. Now let's go into this abuse. We know that recently the federal government banned a particular drug because of the abuse of that drug. What is that drug really meant for? We're looking at drugs like tramadol, drugs like codeine. What was codeine really meant for? Why did we even have that drug before? What was it used? What was it supposed to cure?
Well, codeine is an opioid. Even the tramadol is an opioid. Now, these are drugs that have good medicinal value.
Okay.
But they also have high tendency for abuse.
Let's look at the good side first.
Okay. The legal is a legal drug, but codeine, as in low doses, can be used for the treatment of dry cough.
Okay.
What we refer to as non-productive cough. In other words, you are coughing and then nothing is coming out, and then you are having pains. Such coughs are possibly due to inflammation, viral infection, and allergy. So you need a drug that can soothe, prevent that pains associated with the cough, and codeine does very well as a drug of choice. Although there are alternatives, but because of its effects, opioid effect, and analgesic effect, ability to reduce the pain associated, is a good drug.
Okay.
But what is now leading to abuse is that people are no longer taking it for cough. In other words, the people that are abusing codeine, they may not necessarily have cough. And also they are taking excessive doses. Instead of taking 5-10 mils, you see somebody take a full bottle of codeine, and a full bottle may contain as close more than about 280 milligrams. And you don't need all that. You just need about 5-10 milligrams, maybe 3 times a day. So taking a full bottle at once is an abuse. He's no longer doing the work he's supposed to do. He's now causing other effects because it excites the brain directly. And when the brain is excited, after the euphoric effect, you begin to see some other effects leading to it. And that is why we say that drug abuse is not just a social problem. It's now a medical problem leading to psychosis, mental disorders, and all you are seeing. You need to check the streets, and then there was a new psychiatric hospital. And all these are drug-induced.
Let's look at the problem, the intake of this drug is causing in the society. Let's see how we can find a way to make it good for you and I who is watching. Now we have quite a number of young men, young girls out there who are so high on codeine, and they do not see anything wrong in it. They do not see anything bad about it. They don't think it is a problem. So it's that problem I want you to talk about this afternoon. What is the problem? People out there should know that taking this drugs when you're not supposed to take this drug, and taking this drug, abusing the drugs in the process, is a huge problem. Because some youths out there will tell you, even to tomorrow, that look, nothing is happening. People have been taking it and nothing has happened, and people will continue to take it.
Yeah. The truth of the matter is that I will say the root cause is one, there are many factors anyway. One, lack of parental control.
Lack of parental
yes,
control.
Yes, it's a very, very important factor. Then we have environmental factor. Although some of you can also, genetic and mental disorder can also be a factor, because there are some people that generally they are aggressive
by nature,
stable by nature, so they want to maintain that, so they will need to take some boost. And you also see situations where peer pressure is also a factor. Okay, my friend is taking, I went for a party, my friends are taking, so I have to take. And the government has made it very easy for youth to have access to this drug. Because once you restrict access, some people will be restrained. But if I can easily be supplied, I tell you that it has gone to a stage where people are now even supplied right from their homes. And go to the motor parks, go to the protests, go to the event centers, and you begin to see that people can easily get this drug. And once there is easy access, of course, abuse is inevitable.
Is there not a control measure?
Now,
to control these drugs from coming into
yes, from the pharmaceutical society angle, we have tried to, in fact, at our national body made presentation to the National Assembly, I've written to the presidency that this codeine with syrup, take it from over-the-counter drug and make it a prescription drug. So that if you don't see a doctor to prescribe the drug, you cannot take it in the first place. So anybody that dispenses the drug without a prescription, it runs foul of the law.
But that does not seem to be working, because I can walk to a pharmacy store and say, okay, I need so drug, and I will get it without prescription.
The government have not really implemented that. There is no law to that effect now that they are trying to totally amend, but we shouldn't have taken time. Just say this drug is no longer in the essential drug list, it's now a prescription drug. The other factor is that we have also put pressure on government that the chaotic drug distribution is not helping matters. Normally, like I said, some other fora, a drug, whether manufactured or imported, will go through the distributor, to the wholesaler, to the retailer, before it gets to the end user. But now, I can even move to Onitsha market and buy drugs. And we have told government, stop open drug market. Have a national drug distribution guideline such that if a drug is entering this country or is manufactured, you can trace its history. So person manufactured it, this is the lot number, the batch number, these are the distributors, this one got this one got this. Then at the retailer level, you have what we refer to as a policy book. When you dispense, you write down what you have dispensed. So the government can easily trace the movement of the drug. This is the quantity that was manufactured, this is what got to you, and this is what you have used, these are the people that requested for it, and of course you cannot dispense higher than a prescription. So at the end of the day, when you have measures of control, abuse will be curtailed.
But whose problem is it to maintain this control? Whose problem is it to put this law into place?
It's the problem of government.
But the Pharmaceutical Society of Nigeria...
We have made our presentation, I'm telling you.
Like, it seems like the force is not much. You're not pushing the government enough.
The National Drug Distribution Guideline have been something that we have been talking about even since when Dora Akuyili was NAFDAC boss, closing some of the drug markets, in fact, almost at the risk of our life. And then we have made presentation to the government. Government keeps shifting the date. They will say, okay, 2012, 2014, 2000. Now they are fixed 31st of December 2018. We are waiting and praying that they don't shift it again. Because people are making business out of the lives of Nigerians. Well,
while we're waiting for all of that to happen by December, is it not possible for all drugs to be purchased from the pharmaceutical stores with a prescription note? And say, okay, this must go through, this must come from a doctor, duly signed by a doctor, before any drug at all can be dispensed.
Now, let me tell you, that would have been easy if the pharmacist is solely in charge. We are the custodian of drugs. If we are solely in charge of drugs, that would be very possible. But let me tell you what government has done in able to create some economic viability for some persons and allow what you refer to as patent medicine vendors.
Yes.
Which is actually, to the mind of government, is to serve needs and the community where you scarcely have pharmacies or there are short supply. And they have a drug list. They have a scope. But if you go to every patent now, you will see that they exceed their scope. They are the ones that will dispense without prescription. As far as I'm concerned, if any pharmacist dispenses outside prescription, he knows that he faces a disciplinary panel. I'm the secretary of the disciplinary panel at the national level.
Okay.
And if we find out that you face panel, and so we have been trained. We practice based on the law, but there are some persons who, for economic gain, they don't care. You see somebody selling a carton of codeine to a young boy. What is he going to do with it?
Well, perhaps for the sake of money. Anyway, Prof, let's look at the issue of misuse of drugs. Often at time, there's this incident that happened, and I was so shocked that PCM can kill a child.
Of course.
I was in the hospital the other day, and then a child died, and the doctor was like, this child is so high on something as ordinary, the way we see it, as paracetamol. So, Prof, can you just enlighten us a little bit on the misuse of drugs generally, particularly PCM for children?
Now, every drug is actually a poison.
Every drug is a poison,
depending on the dosage.
Okay.
Now, for paracetamol, you can take, paracetamol tablet is 500 milligrams per tablet, so maybe 1 gram, so you take 2 tablets. Now, by the time you exceed the dosage that is prescribed, and even the paracetamol, normally if you get the prescription, it's actually to be taken for 3 days. But you see somebody, I have pain, he takes excessively.
Take like dose. 4, like 6.
Yeah, say, let me just take the one that will. Even the tramadol that we're talking about, which is also a very potent opioid for have high analgesic value that can kill any pain. It's supposed to be 50 milligram BD, that means twice a day. 50 milligram in the morning, 50 milligram. But you now see these people
just swallowing a whole packet.
They take 200 milligram. In fact, the illegal products now, 200 milligram. And so you see some of all these workmen, they just take 200 milligram, they will walk as if they are dead bodies because they don't feel any pain. So any drug you misuse, at a certain level, it causes damage, like the paracetamol you're talking about now. At high level, it causes liver damage. Every drug, when you exceed the dose that you are supposed to take, and for the period you are supposed to take, there are side effects, there are adverse effects associated with every drug.
Okay. All right.
Even water, when you take water in excess, you know that you have to be urinating frequently. and then some other issues can also arise because you are overhydrated.
Okay, you're watching Healthy Living on ITV, and we are looking at two things in particular. We're looking at abuse of drugs and the misuse of drugs, whether prescription drugs or the one you just go over the counter to buy. You must also know that it is poisonous. According to the pharmacist, every drug is poison, but depending on how you take it. Now, if you want to call us to ask the doctor question as regards drug use or abuse of drugs, please let us stick to the topic we're talking about. You give us a call on 052-290-573, and the WhatsApp number is going to come on your screen shortly. But call us on 052-290-573. All right, give us a call on that number. Ask any question that you want to ask, but also know that a child can die from overdose of PCM, what we all call paracetamol, everywhere, because every little thing, one is taking this drug and all that. Okay, Professor Okeri is here with us. He's the chairman, Pharmaceutical Society of Nigeria, Edo State. So feel free to call him and ask questions. All right, Prof, let's look at the effects of the misuse of drugs. Where let's take it from overdose, because there's underdose too. When you overdose on a drug,
well, when you take an overdose of a drug, let me try to create a scenario.
Okay.
Now, you know that you are taking a drug into the system. There is what we refer to as the minimum therapeutic level. So that is what made the manufacturers to fix that minimum
dose.
Then there is what you refer to as the maximum therapeutic level. Within those two spaces I've described now, you have what we refer to as the therapeutic window.
Okay.
Now, when you take an overdose, you go above that, and above that is the toxic level. And so you see situations where you have in your system more than what is needed. And when it stays excessively in the system, it begins to cause other effects.
How long would that be? How long would it take?
It depends on the half-life of the drug. Because every drug, in fact, you take drug based on the half-life.
What do you mean by half-life?
Okay, there's a period of time a drug will normally reduce to a level that it may not be dangerous to the body, and then is excreted from the system. Some drugs, that is why you can take one. There are some drugs you take only one a day because it has a long half-life. It can stay in the system for long. There are some drugs 2 times. The half-life is probably about 12 hours. So if you take a drug, by 12 hours, it has reduced. So you need to add to keep the therapeutic level. But when you now begin to take excessively, you get to the toxic level. And also, when there is underdose, you don't get to the minimum. So there will be what referred as therapeutic failure.
Okay.
And so you are taking a drug, and that is a major problem now. You see situations where people are taking drugs, especially when the drugs are fake, and you don't have enough concentration of the drug to exert the action. And so you won't have treatment. Another problem of that is that the organisms, for example, microorganisms, they begin to develop resistance. And so you take a drug, it's not working because the organism have already developed resistance. And then when you also overuse some drugs, eventually when you not need the drug, because there's not tolerance, there is reduced response to the drug, that is what we refer to as tolerance, you now find out that drug will no longer work for you. And that's why doctors will normally tell you, for example, if you want to use antibiotics, they tell you to use from the lowest one, even analgesics. You can't start by using tramadol. Tramadol is a high-class analgesic. You use lower analgesics, drugs so that when you don't have any action, you step up. When you now start from the top, and the top doesn't work, what will you now do? So overuse and misuse of drugs is very dangerous, and is one of the things that is affecting recovery from ill health. And so you see people, they are sick, you are treating them, you give this drug, there's no action. Because
let's look at the issue of malaria drugs.
Yeah.
which we tend to abuse a lot, malaria drugs.
Yeah.
How often should one take malaria drugs in a year?
Well, you don't really need to take, we can't prescribe the number of times. It's depending on the incidence.
Okay.
So you can take malaria drug, but ideally, if there's proper hygiene, you prevent mosquito bites and all that, you're not supposed to be having malaria frequently. But when you do, most of the drugs are taken for 3 days or so. And if you take the drug as prescribed when you are supposed to take them, it should clear the parasite from the system unless there is resistance.
You know, there are times you take malaria drugs for the required time, the recommended dose, and all of that, and after about a day or two, the malaria comes up again.
Yeah, that's what I'm saying.
And you're compelled to take drugs again.
That is what I'm saying. That means that malaria parasite have developed resistance to that particular drug you are taking. Or the other way you can look at it is that the product has issues. Because we see fake and substandard products everywhere. People smuggle products everywhere. They relabel. For example, a drug has expired, and then the person pick up the blister, change the expiration date. Maybe a drug that is supposed to have expired in 2013 or 2015, you change the 5 to 8. So it becomes 2018. And the drug is still in circulation. And like I said before, drugs have their own half-life. They also have their shelf life. Shelf life determines the expiration date. Now, if a drug has expired, what we are telling you is that the concentration of the drug in that system are falling below short of the recommended level. And so if you need to take that type of drug, it means that you are going to take an extra amount to be able to get a therapeutic level. So the quality of the product is important. The previous use of the drug, and that is why when you go to the hospital, the doctor will ask you for your history.
A lot of people don't like to go to hospitals. We see a lot of adverts on television, advertising malaria drugs and all. And somebody who is suffering from one could just look, oh, I saw one drug on the TV, quickly write the name down, and then you go to the pharmacy store, you buy. You don't have to see a doctor. You buy the drugs and you use. And
that is not proper practice, because actually...
But the adverts are there.
Let me tell you, no, drugs are not supposed to be advertised. The only drug that you can actually advertise is OTC drug, which is maybe Panadol, paracetamol. You can advertise those ones for pains. But every prescription drug, you need proper diagnosis before use. You cannot just say, oh, because you advertise, and then John can say, this type of headache I'm having is hypertension. There one traditional person was saying over the phone that he can cure this, can cure it. And you begin to take what you are not supposed to take.
No, we are looking at drugs now. Everywhere you see malaria drugs on television, like that. Anybody can just, what's the need of seeing a doctor? If they're advertising drugs on television, why should I see a doctor? You just go buy the drugs and use.
But that's what I'm saying now. Even if you have, there are different classes of malaria, for example.
Yes.
The parasite that causes malaria is different. If it's Plasmodium falciparum, that one will need special attention. So any other drug you are going to take may not have the same effect. So the fact that you are hearing on TV that, this drug can cure malaria, you need a test to be able to say, this is the type of malaria. This is maybe it's 1+ or 2+ or 3+. The severity of the malaria. Those are the things that will not determine how your dosage regimen will look like. You don't just come up and say, because they advertise, then you pick the self-medication. And self-medication is dangerous to health. You are even endangering yourself because you have treated malaria superficially. Maybe the symptoms have gone, but it's still in your system. And so, over time, maybe next week, you present with malaria again. So, it's better you go, let there be proper assessment. And then you'll be able to say, okay, based on what is your ground, this is what you are going to take, this is how you are going to take it. And then once you comply, you will have results.
Okay, let's look at another scenario now. maybe you're giving a child malaria medicine, and you know that most of these children don't like to take medicine at all, you know, and you give it to their child, maybe almost immediately or a few minutes after the child vomits that drug. Are you to give that child that drug again immediately?
Well,
whether malaria drug, whether antibiotics, whatever drug it is.
Yeah, what made the child to vomit in the first place? Those are the things you need to consider.
You know, like some kids don't like drugs.
Yeah, I understand. Now, a child has vomited. You are not able to assess the quantity he has absorbed, what has been vomited. So what are you going to give? If a child is vomiting, there are other routes of administration. Either you find a way to get the drug into the system by any injection, either intramuscular or intravenous, or there are some other means of administering the drug. Okay, maybe through the rectum, and there are patches now, for example, presently. So you mustn't give the drug orally, because what if, God forbid, that the product eventually goes through the trachea? So you have other, that is why we said, don't just give drug. When a situation gets to an end, take the child to an expert, let it be managed. This issue of everybody feels that he knows what to do. It's just like, oh, because I was there when the mechanic was fixing my car, and I feel that, okay, I can lose the tire and do this, and human life is like a machine, and you need to understand the mechanism and how the body works before you don't just introduce anything to the system.
Does it also apply to pain killers, pain relief, the way we take it? Like we were given a scenario about a bricklayer or a workman who feels that no, he needs to work, and then he takes like overdose of the normal dosage you were supposed to take.
Yeah, you're actually overloading your system. You compromise your excretory system, compromise the liver. You have been seeing the incidences of liver failure, and this one they say liver pack up. These are the things that our forefathers and elders, they didn't experience some of these things. They were eating vegetables, fresh food, and all these things we are taking compromises the system in one way or the other. You are overworking your kidney, you are overworking your liver, and so at the end of the day, you are reducing your resistance.
You know, we have a way of wanting to copy what others are doing, or listening to our peers, listening to our friends, our parents. Oh, I was sick the other day, I had body pains the other day, I took 4 tablets of so-so-so drug, and it worked like magic. Why don't you try it? Any need to go to the hospital, there's no need. Just go to the pharmacy, they buy it and take. What is the effect of this practice?
That is what I said, that is self-medication. And the fact that somebody took a drug and it worked, it does not mean that for example, let me give you an example now. Maybe I have headache. Somebody else is also presenting headache. You don't know the cause of my own headache. Her headache may be due to malaria. My own headache may be due to hypertension or some other issues. Because when you have illness like ill head, what is important is not to treat the symptom. Is to look at the root cause. It's just like we are just treating the symptoms, and we are not looking at the root cause. You cut a tree, you leave the root, and you know that this tree has a potential. Once rain falls, it germinates again. So that is what happens. So you need to know what is the case of that, my friend. What is also my case? Are they similar? Yes, there is headache here, there is headache here. But does it mean that it's the same? It doesn't follow. So you will need a proper assessment. Some other questions also need to be asked. For how long have you had this headache? Have you always had it? Is it prolonged? What do you take and it will reduce? Those are things that we need to establish to be able to get to a stage where you say, okay, you can take this. But self-medication, the fact that it worked for you even last week does not mean that it's going to work again this week.
So what are the things we should put into consideration when taking drugs, whether prescription drugs or drugs we go buy over the counter?
Well, the major consideration in taking drugs is that take it when you need it. If you don't need a drug, if a drug has not been prescribed to you, you don't need to take it. There are even things that we behavioral changes, for example. As little as changing your diet, reduce salt intake, for example, do some little exercise, reduce the amount of alcohol you take. Those normal behavioral changes and yes. Nutritional changes can go a long way to help. It's not everything you just say, oh, I need to take a drug. If you need a drug, let there be a proper assessment. That's what we are saying. It's not that the pharmacists want to just necessarily make money, but there are things that, and that is why we also say that pharmacists' practice are gone beyond dispensing. Just come and I'll give you the drug and you go. No, we do what we are referred to as pharmaceutical care. Okay. We want to ask you, okay, have you checked your BP? Have you checked your blood glucose? Have you done this? Are you sure this is not linked to this? We want to be involved. We want to ask questions so that we know that you are not just coming to my premises to buy drugs. Okay. So we want to show that concern and show care and be able to assess that whether you need the drug or not.
All right, the number to call us on is 052-290-571, and pharmacist Professor Henry Okeri is on the hot seat and is waiting for those your hot questions. Ask him any questions that has to do with drug use or drug abuse or drug misuse, as the case may be. Now, Prof, let's look at the issue of drug addiction. There are some people that cannot function without taking one analgesic or the other. They just cannot function. We need to look at, okay, there is a call. Hello?
Hello?
Hello, good afternoon. Hello?
Hello, good afternoon.
Good afternoon. What's your name? Where are you calling from?
My name is Osman.
Okay, please ask the pharmacist your question.
All right. I've been listening to this.
I need you to speak up a little bit, please.
All right. I've been listening to this program, but I haven't seen my daughter have 60 milligrams.
You haven't seen what?
Any tramadol tablet that has 50 milligrams.
Gee, you are wanting to see the... You haven't seen it on the program?
You said?
You said you haven't seen what? The drugs on the program?
I haven't seen any tramadol tablet that has 50 milligrams. Because you mentioned something concerning 50 milligram tramadol that maybe you might have something that you want to take tramadol of 50 milligrams, then you want to take tramadol of 100 milligrams, 100 milligrams.
Okay, you haven't seen it?
No. So what is he talking about?
Okay. He said he hasn't seen 100 milligram of such a drug anywhere before.
50 milligrams.
Well, as a pharmacist, we see that the drugs, the tramadol is actually supposed to be 50 milligram, which you are supposed to take 2 times a day, or you can, if the pain is severe, you can take 100 milligram. Okay. But that's times 2. Yeah, in the process of our enforcement, because we have had to do some enforcement with NDLEA, NAFDAC, you see 200 milligram, 1 tablet, 200 milligram. There is even 225 now, which I feel has smuggled into the country. In fact, I was discussing with the NAFDAC coordinator, Edo State, recently, the state coordinator, and that they seized a large cache of tramadol, 225 milligram.
So we need to state the dangers of this drug so that people know and desist from taking these drugs.
The dangers are that, like we have said now.
We need to re-emphasize it, sound it very much into the hearts of youths especially.
Okay, let me create this. Now, when we talk about drug abuse, there are drugs that for example, heroin, marijuana, their chemical structure is similar to the neurotransmitter of the brain.
Okay.
And the major neurotransmitter of the brain is what we refer to as dopamine. Now, when you take the drug, because it's similar in structure, it goes straight to the brain and stimulates the brain. And so you have that, you are like on top of the world. You are high. You just, if you had problem before, you don't think that you have problem. And that is why the youth are abusing it. And like I said, when I was in EBS last week, I said part of the problem is that the youth are idle. Government have refused to produce jobs. They are idle. They are
if government
jobless.
refused to produce job, is it an excuse?
It's not
for
an excuse.
You to get high?
It's not an excuse anyway. But you know, when you are poverty is a disease. When you feel that this life I'm living now, let me forget my sorrow. You want to drink, you want to do something, and
okay. Hello.
Try to forget your sorrow.
Hello, caller.
Good afternoon.
Good afternoon. What's your name, please?
My name is Jerry. I'm calling from Benin.
Okay, can you speak up a little bit?
Okay.
Go ahead.
I want to ask a question about that tramadol drug.
Why is everybody concerned about that? Okay, go ahead.
Because sometimes when you take maybe 200, it will not work for you. You have to take more. Why is it like that?
When you take 200, it will not work for you. You have to take more.
You have to take more. It will work for you. Why is it like that?
Okay.
And sometimes when you are looking for 50 milligrams, you will not see. I don't really know. Even more drugs like that, when you take, even my life, when you take it, it will not work for you. You have to take overdose. It will work for you. I don't really know. What is the problem with the drug? Okay,
you heard him. It takes 50, it doesn't work for him. He has to like overdose himself before the drug can work. Is that not a problem in itself?
It's a problem. That is the addition. That is why it's not. I was trying to explain the scenario.
Yes.
Scientifically. Now, you stimulate the brain.
Okay, hold on, Prof. Hello?
Hello?
Hello, caller.
It's not only tramadol. Most all the drugs, even malaria drugs.
Yes.
Yeah.
When you go to a pharmacy, provide drugs for any malaria drugs, after taking will not work. They will add another one to it again. More overdose. I don't really know what is wrong with the drug.
Okay. When you take a particular drug, it doesn't work. Not just the tramadol that almost everybody is high on, but other drugs. Yeah. You take the recommended dose, it doesn't work for you. You have the tendency of taking an overdose before you feel that this drug is not working.
No, but the truth of the matter is that is why, you know, I mentioned treatment regimen. You have, for example, what we refer to as loading dose, maintenance dose, and so drug, you take a drug and drug is taking over a duration of time. We don't expect to give you, load the drug, let the system, let the problem
work now.
solve. No. It's over a duration of time. Because you need to also look at the drug you are taking vis-a-vis your body physiological system and the general mechanism. So you take it gradually. This is the therapeutic level. Like I said before, there's a therapeutic window, which the concentration of the drug must be at that level if you want the system to be normal. If you exceed that, you go to toxic level, and that is not good for anybody. So because you begin to cause some other damages, it's better to take a drug. Why will you take 50 milligrams and say it didn't work? What makes you feel that it didn't work? Because you are still feeling the pain? The fact that you are still feeling the pain is telling you that yes, you still need to take more, but not immediately. You need to wait for the next dose. So because when you pass that level, these are the things that now you are forcing your brain to release dopamine into the system when it's not necessary.
And what's the work of that dopamine into the system? Once you release
the dopamine makes
the system,
you to be alert, makes you there's a dopamine surge. You are stimulated, you are high. You will feel that you can even carry a vehicle. Then you see a vehicle coming, you think that it's still far. You are on top of the world. You forget your sorrow. And not that. So they feel that effect. Now, the body begins to feel that this neurotransmitter in my system is too high. So the brain will try to adjust that. Why do you need this dopamine surge? So it reduces the amount of dopamine is now releasing. And that is why you find out that this drug addict now have mood swing. At that time, the brain has adjusted, they are moody. So somebody that was just happy now is no longer happy, so he's now moody. He needs to take another dose for dopamine to also to not be released. Not even another dose, higher dose, because the brain has adjusted in such a way that it does not want to release that.
So what's the long-term effect of this?
The long-term effect is that you are overstressing your brain. It leads to mental disorder. It leads to because these are psychoactive drugs. And so when you abuse them, you are pushing your brain. It leads to death. It leads to suicide. All the crime self. You will see.
I think we have a call. Hello.
Hello.
Good afternoon.
My name is Eric. I'm calling from Benin.
Okay. Welcome.
I just want to know because sometimes when you went to buy these drugs, tramadol.
We're not concentrating on tramadol. We're looking at drugs.
But it's a major issue.
But okay, go ahead with your question, please.
Okay. These drugs, this tramadol thing, if you at least buy 100 milligrams, as the other man said, it will not work. Unfortunately, they will advise you to take another 100 again.
So we look at underdose of drugs. When people are asked to take drugs for certain duration and certain number of tablets, you know, if one manages to take, like, if they say like 3 tablets now, you take 2 later. If I manage to take 3 and I get better, you just discard the rest. What is the effect of that?
Well, that is also a problem. Because, like I said, treatment is supposed to be for a duration of time.
But one can just get well so suddenly after taking like 2 and say, I'm done with this drug.
There's even a problem missing your dose, like some people will do at times. Maybe you are supposed to take a drug 3 times a day. You take the one in the morning. You now forget the one in the afternoon. You now want to take the 2 in the night.
Yes.
There's a problem with that. Because, like I was explaining before now, the concentration of the drug should be within that range. Now, when you take the morning dose, you are supposed to take afternoon so that you can get the level back to the therapeutic window. When you miss that afternoon, the drug goes so low. When you take the 2 in the night, you will shoot the therapeutic, the maximum level. So you also go to toxic level. So that is why we advise people, take your drug when you are supposed to take it. And then when you miss, for example, you are supposed to take drug for 5 days, you are not taking for only 2 days or 3 days, then you stop because you feel better. You feel better does not mean that the organism will be completely removed. It's only that why you are feeling better is that you have controlled it to a level where you are not feeling well. But the organism may still be there. Your immunity also is responding. So you need to complete it to be very sure that, the organism will be taken care of. So you don't stop taking drugs because you are feeling well.
Okay. Hello. Good afternoon.
Hello.
What's your name, please?
I'm calling from Mexico.
Okay. What's your name?
No.
All right. Ask the pharmacist your question, please.
I have 2 questions. Any drug that 400 milligrams?
Concerning what? Can you please speak up a little bit?
Any drug that is 400 milligrams?
Okay.
How many do you have a day?
Any drug that is not 100 milligram?
400.
Any drug that is 400 milligram?
Yes.
What happens to such a drug?
How many do you advise to take a day?
Okay.
No, it depends on
The second question is, if you take malaria drugs maybe for 3 days, then the sickness returns, do you advise to take the drug?
Okay, you got his question?
I didn't get the second question.
Okay, the second question.
Yes, that is the second question.
No, could you come again with the second question?
If you take malaria drugs for 3 days,
okay,
and the sickness remains, do you advise to repeat the drug?
Okay, if you take malaria, if one take malaria drug for 3 days for the prescribed days, and then the sickness remains, is the person advised to repeat the drugs again?
Yes.
Okay, the first question was if it's 400 milligrams,
Yes.
whether how do you take it?
Yes.
Every drug have its own dosage.
Okay.
The quantity of drugs differ.
Okay.
Like if you talk about the Misuse, for example, it's very low because the therapeutic window is very small.
Okay.
If you take excess, you overshoot, and that will be a problem.
So it's best for you to see a doctor
Yes.
and take the drug as prescribed.
So drugs are different. Like I said, every drug is a poison. So depending on how toxic the drug will be, that is what determines the dose. That is why you see that some drugs is 5 milligrams. Ordinary 5 milligrams is
It's
okay.
okay.
But paracetamol 500 milligrams.
Okay.
For example, you see all these amlodipine.
Okay. So let's quickly answer the second question
Okay,
now.
the second question talks about malaria medicine.
Yes,
Now,
after
if you are
taking your
taking
prescribed drug and the malaria is still
after
there.
taking the prescribed drug, and you still feel that you are still not fine, the best thing is to report back to your doctor
and not
be
to
able
take
to
the
say,
drugs.
I've taken this drug before. Then possibly, for some of us who are in the custodian of the drug, you may also get back to us. We may begin to look at, is the problem from the drug?
Okay.
So we can analyze the drug, for example, and be able to say, the drug either is substandard or so.
So the best for the person is to just report to the appropriate quarters. All right, people, this is what we're going to do today on the program, Healthy Living. Please note that every drug is poison according to the pharmacist. It depends on how you now take the drug. If you take it as prescribed, then you're good. But if you overdose or undershoot, then you will find yourself in another problem. And don't forget that when you're taking drugs that are not prescribed, you're disturbing your liver, your kidney, and all. We'll see you again next week. Bye for now.